Welcome everyone to another episode of Talking Team CBT with myself, Daniel Herman, and Angela Poach. And we're just really super excited today for another episode. And for our guest who we have, we'll introduce Dr. Cai Chen. Barely, I think, needs any introduction. He's a psychiatrist, a level 3 TEAM-CBT certified therapist now at the Feeling Good Institute. And he's licensed both in California, Texas, doing diagnostic medication and I know fantastic therapy services. So we're just absolutely thrilled to have you on our show, Cai. Welcome.
Yeah, great to have you, Cai.
Thank you. I appreciate the really warm welcome. It's really cool to being able to hang out.
Oh, joy is really ours. We were reminiscing before the show. Kai and I had the pleasure of training in a group way back with Mike Christensen, one of the 12-week training groups. And I guess that's a good way to kind of start off. We always like to kind of ask our guests, Kai, a little bit about how their journey with TEAM started and how they got interested into this. And clearly, you took a deep dive once you got interested, but maybe you could tell our viewers a little bit about that journey.
Yeah, definitely. So, back in 2000, my journey with TEAM started back in 2019. I was in my third year of my psychiatry residency, and I was expected to have therapy patients, at least 2 at that time, but I had no therapy patients, and I was supposed to have therapy supervision. Unfortunately, our therapy supervisor, her partner had contracted a terminal illness, so she had to take time off. And so we didn't have a therapy supervisor. So I was kind of bummed out. I was like, well, I need to learn how to do therapy. So I asked myself, how am I going to do that? I can either just wing it and do my best, which is probably not very ideal, or I can try to learn in some form or fashion. And so I didn't want to wing it because I didn't want to cause any problems for any of my patients. So I decided to learn therapy on my own. And so I decided, do I want to read a book and learn how to do therapy based off of that, or do I want to find other resources? And I decided a book is very boring. I don't like reading a lot of therapy books because I picked up a couple on psychoanalytic theory, and they either were very boring or they made me very scared, because I was like, how in the world am I supposed to change any of these things about myself when they're so self-ingrained and that kind of thing?
Oh yeah, it could take probably
that's
10
how I
to
end
20
up.
years, right? And then you could.
Yeah. Definitely 10 to 20 years if you're lucky. Then maybe eventually one of these switches in your brain will change or something with the psychoanalytic text. Anyhow, I decided to just look for podcasts, because I actually learned quite a lot about psychiatry from podcasts. And so I had 2 choices. I had the Feeling Good podcast, and at that point in time, I had no idea what Feeling Good was, and another one called Psychology in Seattle. I just flipped a coin, and I ended up with Feeling Good. And so that's how I got started with my TEAM-CBT journey. And David's claims were very grandiose, to say the least. But I was kind of turned off at first, but he spoke with such confidence that I was like, okay, well, if he says it works, let me just try it out. And so I tried out quite a few of the techniques myself, and it worked. And then I started doing a lot of testing on my patients, and ever since that time, I was absolutely hooked onto TEAM. So that's how my journey got started.
That's awesome. I knew the story about you finding the podcast, like many of us, as an entry point, but I did not know the fortuitous, you could have gone with Psychology in Seattle versus TEAM-CBT. So it's amazing how these little things make such a big difference.
Yeah, I know. When David was first talking about TEAM, I was like, what the heck is TEAM? Is he just trying to sell me his book or his program or something? Yeah.
Yeah, I think that coin flip was very, very cool. You mentioned that David spoke with such confidence that it gave you the idea, I'm going to test this out myself. And I love that about TEAM. I mean, that's part of TEAM is testing. We do test things out, but but more than that, kind of that borrowing confidence is something we tell therapists early on when they're first getting started is, if you don't have the confidence, that's okay. You can borrow it from David or from one of your mentors.
Mm-hmm.
And certainly I did that myself when I was green and just getting started and under supervision. I definitely had to borrow some confidence from someone else. Absolutely. What is maybe one thing that obviously it sounds like you, not obviously, it's, it sounds like you got started doing team. So you're,
Mm-hmm.
wasn't like you had a practice and then you learned about team. So you've kind of, launched team right out the gate. So it may be an awkward question to ask. I was thinking about what one thing that team surprised you, maybe from your past education on psychology or the brain. What's something that surprised you about team?
Yeah, that's a great question, and I appreciate that question a lot because it's not something I really thought too much on. But looking back, I think the most surprising things that I learned from TEAM-CBT is that empathy is a skill that can be learned. Because prior to learning about team, everything I was reading was like, oh, empathy is just a thing that you come across and eventually you get better at. Team was the only one that said that, okay, there are specific skills within empathy that you can hone and improve on, and that you can look out for to see if you're doing a good job on. So that's what really surprised me. That was a very pleasant surprise. It's helped me a tremendous amount. The other really big surprise was the agenda setting and methods. The idea that our negative symptoms are actually positive expressions of what we want out of our life and what's positive and beautiful about us. No one ever really taught me about that. They might have hinted a little bit at it, but team was the first one that kind of went in full steam in terms of that idea, and it just completely changed my perspective in terms of therapy and treatment. And then the final thing that really surprised me was just how many gosh darn tools there were. There were tons of tools. It was very intimidating when I first looked at all of it. I was like, how in the world am I supposed to learn all this stuff on my own without any supervision? Because it was so intimidating. I went from no therapy techniques whatsoever to over 50 and close to 100 according to what David was claiming at that time. I was like, there's just no way. But somehow with consistent practice and just continuous exposure and really good supervision over time, I've been able to pick up and learn a lot of those tools. So those were a lot of the really surprising things.
Neat. The number of tools was exciting to me. It was terrifying to learn perfectly because I'm a perfectionist. So I'm like, how am I going to learn these perfectly? But it was exciting in terms of I'm always trying to learn more because I'm a bit of a cynic. So anyone who says this one thing will work for everyone, I'm like, no way, that's not possible. So I think that maybe ingratiated me toward team was the fact that it was no, there isn't one size fits all. There's different mindsets, different thinking. And so I think when I tracked them out, if you really separate them, like the 5 secrets of empathy, if you separate those into 5, if you really segregate them, it's about 123, I think, in the last list. And if our viewers want to see that, that's on David's website, feelinggood.com. There's a database of the tools and podcasts for our viewers if they'd like to go there. Yeah, it's pretty cool. And that empathy can be learned. That's a really important thing too.
Yeah. I wanted to ask you, Kai, not only are you, an excellent therapist, and we could, Angela and I also do, therapy as well, but, you're a psychiatrist as well. So I'm really curious, how, you kind of incorporate that in terms of, you do diagnosis and you're at times, I guess, medicating patients. I'm curious how that especially integrates with the therapy work that you do.
I'm so glad that you asked about that because the great thing about team is that it's a structure. It's not just one size fits all. You apply the different tools and different mindsets to whatever it is that you're doing, and you can do the same thing with diagnostics and as well as medication management. More so medication management compared to diagnostics, actually. But the diagnosis is relatively simple these days for me because I just use David's Easy Diagnostic survey, which helps to like rule in or rule out a bunch of different diagnoses, and then I'm usually done with diagnosis within 1 or 2 appointments. Like that's it, and I don't have to like do like what I used to do, which was like try to make a quick and fast diagnosis during the first meeting, and then wait and see what the heck happens within the next 6 months, and see if I need to change the diagnosis at that time. It was just boom, done. So that's been very helpful. Now the other thing is in terms of medication management for TEAM, it's been incredibly helpful, because the different aspects, like testing, for instance, like self-monitoring for bipolar disorder, is very heavily important in terms of tracking their moods. But the biggest aspect that I found most useful for medication management is actually the agenda setting component of it. Setting appropriate expectations and limitations that medications can and cannot do. For instance, whenever I diagnose a patient with bipolar disorder or schizophrenia, it's an absolute requirement for them to take a medication in order to get better. I used to not have that rule or policy before, and it would usually be kind of disastrous. But then the other part is, but that that's more on kind of obvious. If you have bipolar schizophrenia, you need the meds. But for depression and anxiety, I do agenda setting in the sense of, well, there's going to be good reasons to take the medications and good reasons to not take the medications, and I won't push you to do one thing or the other. I'll just share with you, in my experience, what the medications do. What they do is they lower the intensity of your symptoms. They numb quite a few of your negative emotions, and they may quiet down quite a bit of your negative thoughts, but it won't make it go away. It'll just make it so that it might be more quote unquote tolerable, and it might make it easier to do therapy, etc., that kind of stuff. I make it clear to my patients that that the medications will not make you happy. It's just not the case. And having that conversation and setting that agenda, and so then the patient is the one deciding if they want to take the medications. It's actually improved the effectiveness of the medications somehow. The more they felt like they were in control of what they wanted out of the medications, the more effective they seemed to be. And they weren't like completely 100% effective at all times, but the level of satisfaction taking them was much higher. Whereas before,
it's also so respectful of them, Guy, when you present it that way, and you can also sit with open hands, right?
Oh yeah, absolutely. Absolutely. And the way I set it up as well is that the medications are just a tool set along with all the other tools to help with depression and anxiety. So that's the way that I set things up with patients, and for the most part, it works out pretty well.
Awesome. I love that you're saying it's another tool. When I got introduced to TEAM, I came through Dr. Nelly's depression recovery program, and that was his take on medications. Was it's kind of a tool to help you find the real solution, to help you find the permanent solution, and to not feel ashamed about it if you need to take that tool along that journey. That's totally fine. And what you were saying about how having control and I want to say buy-in, hopefully that's not derogatory, to taking the medication actually improves the effectiveness of the medication, of the success. And I don't want to steal David's thunder, but we're hearing some similar things about the app, that people who like the app actually do recover better. So there is something to do with liking. And I think it kind of ties back into empathy, and why empathy is an important part of TEAM rather than just CBT alone and throwing methods at patients. Wonder if you could give us a little bit of a story of how TEAM has impacted either yourself personally or one of your clients, just to give our viewers a taste of what it's been like in your situation, in your experience.
Sure. I'll just give one example of each. I'll give a personal example for myself. So I used to struggle with a lot of social anxiety and a lot of loneliness. And And so I picked up David's book, Intimate Connections, which I highly recommend to every single person who's listening to this. If you're lonely and you're not having very much luck finding a partner, pick up that book and just do all the written exercises and keep putting yourself out there. And once you overcome those things, it felt really great. I went from like no dates whatsoever after 4 year period of time to like getting a lot of dates and a lot of experience. I kind of speed run through dating until I ended up with my fiance right now. So it got me set on the path to finding a partner.
Nice.
So that's the way Team has helped me tremendously. Learning the tools to kind of help myself feel better, and also to help myself to find the person that I was looking for. So that's my own personal example. For patient examples, just to disguise some details so as not to like reveal any information. I've had quite a few patients, because one of my specialties is suicidal ideations. I've had quite a few patients who've come to me who have been very, very suicidal. And because of the particularly the agenda setting portion of Team, and they were able to recover from their suicidality very quickly, oftentimes within like less than a month. And some of them have even recovered completely from suicidality and didn't need any further help within 3 or 2 sessions. I've had at least one that recovered like just in 1 appointment, and that was just the evaluation. I didn't really do too much, to be completely honest. They said like, oh, I don't like I don't want to do the rest of your treatment. It's not a good fit for me. I was like, that's fine, so long as you don't want to kill yourself, then you're free to do whatever you want. And so yeah, so David is right. People can improve very quickly, and it's been kind of a shock to me. But a lot of the tools in Team, particularly from the agenda setting or assessment resistance, have been the biggest game changer for me.
Wow. Okay. Well, those. Imagine if our viewers want to get more details, they can listen to some of your podcasts with David, where you share a lot more about some of those stories, some of the personal work that you've done as well. So, wish we had more time. We try to keep these kind of short and hard hitting, but I guess we got you one last question. We like to ask all of those that we interviewed, Kai, if they're. We like to ask, if all the therapists in the world were listening to this, what would be the one thing about Team that you would like them to know?
One thing about Team that I'd like other people to know?
Yeah, just all the rest of the therapists in the world.
Or psychiatrists.
Oh yeah, absolutely.
Yes,
The most important thing is the most important thing that you should be doing right now, even if you don't want to do Team, is testing. You've got to test people at the beginning and end of every single appointment, and I don't care what your excuses are, because if you're not testing, then you're not actually helping your patient. You're just like randomly doing stuff in the hopes that they might get better, which is kind of like gambling with their symptoms in their life. So testing is the biggest game changer that you can do. If you don't want to do anything else, just do the testing. That's the only way to know it's if you're doing a good job or not. If you're helping your patients, it's your only form of quality control. So that's the big takeaway that I'd like to share with everyone.
Thank you so much, Kai. I wish we had more time, but it was great having you on. And we'll definitely try and put the podcast that you did with David in the description, the YouTube description below. It was great to have you on. Thanks for being here, Kai.
Yeah, thank you, Angela. And thank you, Daniel, for having me. It was really good. Great pleasure to be here today.
Thanks for watching, everyone. Bye-bye.
Bye, everyone. Bye.
Bye.